So today on your screen I am bringing another video to you. This is a video in which I am showing you that today's patient is having a large number of abnormal sperms. You can see in the footage on your screen that we have a decent number of mobile sperms. However, a few of them are perfect in quality and they are swimming ahead in a straight line. However, most of the sperms that you are seeing on the screen are either moving in the same place or are not having a good forward progression. Also, if you pay a good attention to them, you will find that most of these sperms are not having a good shape. That means that some of these sperms are abnormal in their head, abnormal as far as the mid piece is concerned, or abnormal in their tails. So you can see the various sperms moving on the screen in a very abnormal fashion. So just to make it very simple for you, a sperm that is moving in a straight line or in a very wide angled circle, as in a very wide diameter circle, is almost mostly a good sperm, a good normal sperm. However, most sperms which either move in one place or are moving round and round in tight circles are not very normal. So in today's patient we have chosen IUI as the mode of treatment. As usual, we'll be giving the patient, as in the couple, trial of 3 to 5 IUI cycles in which we hope that they would conceive. If not, the right type of treatment for such sperm related abnormalities is intracytoplasmic sperm injection, also called as ICSI. You can also see on the screen that many of the sperms are dead, and many of those black debris that you are seeing are actually sperm fragments, sperm heads, their mid pieces, and various other types of sperm related debris. There are very few pus cells. However, the patient has already been treated for semen infection, and we have given this couple, as in this husband, a targeted therapy, that is targeted antibiotic therapy for precise control of the semen infection. You can see right in the center of the screen so many abnormal sperms. Do remember to see the end of this video and I'll show you exactly how the process sample looks, where we are getting rid of all the debris and largely consisting of normal sperms. Hi friends and subscribers, my name is Dr. Mayur Pai and I'll be talking about today's case. In today's case, as I already mentioned to you, we have a patient who is undergoing IUI, mainly because of low sperm count and lot of sperm related abnormalities that we have detected during their counseling session, which has occurred right at their first visit. So traditionally, when a couple approaches us, we go into the details of their semen analysis, and also I perform a detailed ultrasound on the lady to find out exactly what is the female aspect of infertility as well as what is the male aspect of infertility. Followed by that, this couple was counseled in detail about their treatment choices. The lady presented to us with irregular menses and polycystic ovaries. That is the main problem that we have found out in the woman. Her tubal patency test, that is HSG or laparoscopy, has not yet been done. So the different advantages and disadvantages of tubal patency tests were also discussed with this couple, and they have opted to go directly ahead with the IUI. So as far as the polycystic ovary is concerned, we are always worried whether she is going to produce good quality eggs or not, that is good quality follicles in this case or not. So we have tried to keep a low budget in this case. With prior discussion with the couple, we began with a Laterazol Stimulation, that is an oral medication. Laterazol is a tablet which comes as 2.5 and 5 milligram single tablets, which may be taken in a dose of 2.5 per day or 5 mg per day or 7.5 mg per day as per the requirement of the clinician. In this case, I have given a 5 milligram per day dose for a period of 5 days. Followed by that, we have done a transvaginal ultrasound. In that, we found that her follicles were not up to the mark, and we have proceeded ahead with RFSH stimulation as discussed with the couple and as chosen by the couple. The various drugs which are there for IUI stimulation are already covered in my channel. Do remember to see all the detailed video about the different drugs which are used in IUI and IVF stimulation. The drugs used for IUI as well as IVF are the same. However, there is a huge difference in the amount of dosage that we do in IUI couples as well as in IVF couples. Definitely for IUI we go for a lower dosage form, whereas in IVF the dose is bumped up to twice or up to 4 times the IUI dosage. So having done all this stimulation, we found that approximately on the 14th day of her menses, she produced beautiful follicles. On right side she had one follicle, whereas on left side she had two beautiful looking dominant follicles. Since there was not much worry about hyperstimulation and it was a well managed cycle, we opted for using our dual trigger, which was a high dose trigger this time. After doing so, we expect very good results in the lady. She has a very beautiful looking endometrium and very beautiful looking follicles, and the husband's sperm count, as I have shown you on the screen, is moderate to low. And the main concern that we have in the sperms is very low motility. So our case today has very low motility, and all this is thanks to very poor quality of sperms. So let us wish the couple a good luck and hope that they conceive in the very first IUI attempt. However, having said all these things and having prayed for our couple, it is very important for us to realize that IUI may not click in the very first attempt, and up to 3 to 4 attempts may be required for a realistic chance of conception. However, we say up to 6 IUI attempts may be made at a maximum, following which if the couple is not conceiving, it is better to reassess the case, consider laparoscopy, tubal patency test or IVF. So the decision is best left to the clinician. This is just a guide for most of the patients or young clinicians learning the infertility treatments about how the case is to be counseled and how the treatment planning is to be done. However, it is best that the patient herself or the husband himself does not try to give the clinician what is to be done, and it is best left to the clinician to guide the couple, and the couple has to make informed choices about what treatment is to be done. Do see this treatment guide till the end, where I show you a process sample for this case, and you will realize how IUI benefits cases of low sperm count, low sperm motility and poor sperm morphology. So as promised to you, I am showing you the final IUI preparation for this patient. As you can see on the screen, most of the sperms are motile. There are a few immotile sperms and few abnormal sperms that are not moving as I would have liked them to move. However, this is much better than what you had seen in the past. So I hope that the couple conceives. Do like and subscribe to my channel for more informational content on IUI as well as all other types of infertility treatments. Good day.